past 2 years or so, we may be a little bit worn out, stressed out, or just plain done with anything pandemic related. And I get that, really do. And that very well may be the case for so many of us. But today, you need to listen very carefully because we're talking about the global spread of monkeypox. An opinion piece in the Washington Post puts it like this. Monkeypox is now a pandemic, and unless we declare an emergency and act quickly to combat it, we risk repeating the same mistakes we made with our COVID-19 battle. I'm joined now by one of the authors of that piece. Dr. Kavita Patel is an MSNBC medical contributor and a former Obama White House policy director. So, Dr. Patel, you're one of my faves. You're my go-to. That piece was a little bit nerve-wracking. Monkeypox is now down in 70 countries. There are more than 9,000 cases worldwide as of Friday, and studies suggest it is mutating at an alarming fast rate. But the World Health Organization hasn't even declared monkeypox a public health emergency. What's going on? Why not?
Yep. Michael, good to be with you as well. And I wish it were on something that was not as sobering as yet again another virus that threatens our globe, really. So here's what's going on. Number one, this is definitely a kind of a virus that we have seen before in the United States. In fact, we're fortunate enough to have genetic sequencing from previous cases. We just haven't seen this level of growth this quickly, and especially across the continents. And I think what's troubling on a clinical level, Michael, number one, the clinical picture is a little bit varied. The incubation time, the rash, depending on how it presents, and it's not something that all of us in the United States have gotten used to seeing. It's not, there are many clinicians, myself included. I've only seen one case of monkeypox before this current kind of outbreak that we're dealing with in our country. However, I think the point of calling something a pandemic, there's a policy nuance to this. The World Health Organization first has to declare a public health emergency of international concern. They decided not to do it, which I do think was a mistake, but they're going to be revisiting this issue. And that helps to mobilize a number of global kind of entities, coordination, and funding, because the last thing we need, we actually have a very effective vaccine for monkeypox. There's not enough for everybody, so we have to use a targeted strategy to get it out. And that is where I can see inequities, lack of awareness. Honestly, Michael, in the D.C. area, as soon as vaccine spots opened up, they were full 15 minutes later. I mean, that tells you what the pent-up demand and the need for better education, awareness, and screening is of monkeypox.
So, Dr. Patel, help us understand how monkeypox is transmitted. What are its symptoms? And who, more importantly, is most at risk and why?
Yeah, so this is very different. I know there's a temptation because we're talking about pandemics and viruses to compare it to COVID. Just think of it very different. There is some role of respiratory spread, but the main spread, the primary spread, and what's been documented in all the cases in the United States especially, has been ongoing contact between skin lesions. And that's why the highest risk populations have been persons who have sex with men, bisexuals, gays, lesbians, transsexuals that have had skin-to-skin contact with others who had had lesions has been flagged as a high-risk population. I do think that, unfortunately, though, that's ignoring the fact that people are just social creatures and they can have contact with others. So the highest risk is when they have skin lesions, Michael, but that can take 20 days to develop. In the meantime, you can have everything from fevers and aches. I would just say this. If you have been to an area where you know there's been outbreaks, parts of the country, other parts of the world, or you obviously, if you've had a close contact that you know of that has been under suspicion of having monkeypox, even if they haven't been tested, get yourself to a health professional so that you can be tested. The good news, if there is good news to have, we have a vaccine that works. We have a highly effective test to check for it. And we have a way to protect people if they've been in close contact. We can do what we call post-exposure vaccination. So, Michael, you don't have to have symptoms. You just had to be in contact with someone who did, and we can offer you a vaccine. It's 2 shots, 4 weeks apart. And that's been seen as at least one of the most effective strategies to kind of stop this from causing the damage that it could.
So just to follow up on what you were saying about the vaccines, the limited supply of those, they're being distributed in the U.S., but won't be widely available for months. What should health organizations and at-risk individuals be doing right now to slow the spread?
Yeah, we should be doing better outreach. Michael, we're just not. I think that we should be trying to promote awareness, just like the discussion you and I are having, talking very honestly about it. Yes, there are high-risk populations, but this is not a sexually transmitted disease. So we need to just be open about anybody having exposure to it. And we've had cases around the world of children. There's just no limit to how it could spread if you're in close contact with somebody with skin lesions or kind of active body secretions. So I do think it's important to say that health professionals should reach out, a vaccine's available, and find out where you can get tested, because that's available to everyone as well.
You're my go-to for a reason, Dr. Kavita Patel.
Yes.
Thank you so much.
Thanks.
Really appreciate it. After the break, folks, new LGBTQ restrictions are in effect in Florida schools, and some of them go even further than you've probably heard. The new rules in one county involving gym classes and overnight trips, and how local lawmakers are responding. I'll ask one state senator coming up next.